Hi, my name is Seema. Today, I'm going to inform you about some of the medical aspects of hearing loss. Hearing loss may occur at birth or may develop over time in children who had normal hearing as infants. The loss of hearing can happen in one or both ears and can be mild, moderate, severe, or profound. Hearing loss can happen in the middle, inner, and outer ear, but the inner ear in particular is affected by genetic disorders. So what exactly am I going to do today? Well, genetic disorders are an area of hearing loss that parents are not familiar with. I'm here to inform parents of potential hearing disorders that are caused by certain genetic conditions so that parents can take proper measures to prepare for hearing loss in the event that there is a risk that their child may develop a genetic disorder or has a genetic disorder. I will also discuss how to protect and preserve a child's amount of hearing, even if their condition involves an eventual loss of hearing. I will also talk about the benefits of genetic testing before and after a child is born. So, basically, scientists have grouped hearing loss into two categories: non-syndromic hearing loss and syndromic hearing loss. Non-syndromic hearing loss is hearing loss that occurs without any other symptoms and accounts for about 2/3 of all genetic hearing loss. On the other hand, syndromic hearing loss is hearing loss that occurs with other medical symptoms and is usually affiliated with some sort of syndrome. Under the umbrellas of non-syndromic and syndromic hearing loss, there are different inheritance patterns that shows which genes carry the disorder. Autosomal recessive means that the child must receive a hearing loss gene from each parent. Therefore, each parent must carry the gene, and the child has a 25% chance of having a hearing loss if this is the case. Autosomal dominant means that the child will have a hearing loss if either parent is a carrier because it is the dominant gene. An X-linked disorder only occurs on the X chromosome. Therefore, in boys, it'll usually appear if only the mother is a carrier, and for girls, it'll appear if both the mother and the father are carriers because a girl has the genotype XX. In the case of mitochondrial gene disorders, every person has genes in their mitochondria. When there's an error in these genes, it's passed on to the next generation through egg cells. So now, let's examine the different types of hearing loss, both non-syndromic and syndromic. In the case of non-syndromic, a gene that's commonly the cause of error is a gene called connexin 26 or CX26. When there's an error in this gene, there is usually hearing loss in both ears or bilateral hearing loss. What's interesting about this gene is that even though siblings may both have an error with the gene, the degree of hearing loss may vary from child to child. Non-syndromic hearing loss can also be autosomal dominant, and several genes can be responsible for this. Additionally, non-syndromic hearing loss can also be X-linked or mitochondrial. Syndromic hearing loss is usually the type of hearing loss that's affiliated with a genetic disorder. I'll talk about a few genetic disorders in which this is the case. Some autosomal dominant hearing losses include losses that result from Waardenburg syndrome, Stickler syndrome, Treacher-Collins syndrome, and in these cases, hearing loss is a side effect of these syndromes. In addition to this, a child may have other facial features that are underdeveloped, such as cheekbones or malformed outer ears, or may have skin tags in front of the ear. Additionally, children may have a cleft palate, an underdeveloped midface, and their eyesight may also be affected. Now, let's explore some autosomal recessive genetic disorders that a child could have. One of the most common types is Usher syndrome, which actually has 3 types, each with varying degrees of hearing loss. In type 1, there is little or no benefit from hearing aid use. However, in type 2, there's a slow downward sloping of hearing loss. Type 3, on the other hand, the child has normal hearing at birth, but later on in life, there's an onset of progressive hearing loss. Some other autosomal recessive disorders include Pendred syndrome and Jervell and Lange-Nielsen syndrome. In addition to these syndromes, there are also X-linked recessive disorders such as Alport syndrome, and there's also mitochondrial disorders such as a maternally inherited diabetes and deafness disease called MIDD and the Kearns-Sayre syndrome, KSS.